When patients arrive for radiotherapy, they are shown to a changing room, where they can remove any necessary clothes and put on a gown. The radiographers will bring you through to the other side of the changing room door when they are ready for you. The radiographers then lead patients into the treatment room and may ask if the patient has noticed any side effects. The corridor between the changing room and the treatment room is called the maze. Once in the treatment room, we may ask you to take off your shoes before you get onto the treatment bed. In this example, we have a pelvis patient who is going to be laying on exactly the same equipment as they had at their CT scan. The radiographers will guide patients into the correct position and then move aside any clothes or the gown to be able to see the treatment area. For some of our pelvis patients, they require the right size bladder for each treatment appointment. Here, a simple ultrasound scan is being performed to ensure that the bladder is the correct size for treatment. The patient's bladder size needs to be the same as their CT appointment. Once these checks are done, the patient is raised up on the bed and the radiographers will move the patient until the permanent skin marks from the CT appointment are lined up perfectly. This is how we get patients back into the same position each day for treatment. With the skin marks lined up, we then move the treatment bed up, down, left or right by very precise amounts in order to make sure that the machine is lined up to target the treatment area. The machine rotates around the patient, allowing the radiographers to check the distance between the machine and the patient's skin at different angles. This is important as it can alert us to changes in patient size or shape, which, if were significant enough, could mean recalculating some of the treatment. The radiographers may need to use some X-ray equipment to check that the patient is in the perfect position on the inside. The patient, bed, and machine are now in the right place to start, and the radiographers will tell the patient that they are about to leave. As they leave, a warning bell sounds to prevent anyone else coming into the treatment room. This gate is a safety barrier fitted with an electric switch, only allowing the machine to be turned on when it is closed. If anyone were to walk into the treatment room during treatment, the machine would stop. The radiographers may start by taking a scan or an X-ray of the patient to accurately check the patient is in the correct position. The radiographers can see patients at all times by the in-room cameras. We can also talk to patients during the treatment via the intercom. After the scan is checked, the radiographers will prepare to deliver the treatment. The treatment itself only lasts a couple of minutes. For most patients, the machine will move around them as it delivers the treatment. The size and shape of the radiation beam coming out of the machine is set by pieces of lead that also move during the treatment, allowing us to target the treatment area and miss any sensitive structures nearby. Once the treatment is complete, the radiographers will come back into the treatment room and lower the bed safely down. Once the bed is safely lowered, patients can then sit up, return to the changing room to put their clothes back on, and then leave the department. Each treatment is the same for each appointment that the patient requires, meaning that each of these steps shown will be very similar for each day of treatment. This example showed a pelvis patient. However, for more shallow treatments such as the skin, we perform a slightly different treatment utilizing an extension to the machine and lead frames with precisely sized shapes cut out of them. When treating using this technique, patients are much closer to the machine and the machine doesn't move during treatment, but the treatments are just as quick.